to pagetiger.com.
When the world slowed down, you didn't. When others started another box set, you started your first screenplay. When others had lions, you did morning sprints. But now, things are real. Go-getters. Time to go get. The redesigned Jaguar range with luxurious interiors, updated Pippy infotainment, and electrified powertrain options. Now available for extended test drives. Contact your local Jaguar retailer to book. Specifications vary per model, terms and conditions apply.
It's 99p week at Lidl, and we're big on big brands at tiny prices. That means you can get Goodfellas deep pan pizzas, Jacob's Cheddars, Walls Viennetta ice cream, and loads of other great brands for just 99p. In store now. Now that's big on quality and always Lidl on price. Subject to availability, selected stores, excludes NI.
I've looked after my kids since they were born. Now they've got kids. I still want to look after them. I don't want them struggling to make decisions about my money or my health if I can't. So we made a lasting power of attorney. Now, if I can't speak for myself, they'll speak for me. It's a weight off for all of us, isn't it?
Yes, Mum. Lasting power of attorney. Search your voice, your decision. This is LBC with Eddie Mayer. Call 0345 6060 973.
There's a change today in UK government's thinking on whether or not the COVID vaccine should be compulsory for anyone. It's consulting, and it wants to hear from you, on whether care home workers who look after older residents in care homes should have the vaccine as a condition of their employment. I want to know what you think. Gareth is a community NHS worker in Essex and says mandatory vaccination sets a dangerous precedent. What about if someone suffers one of the rare side effects? Who will be accountable? If PPE and infection control is adequate in care homes, is this surely redundant? Gareth says, I believe all care home residents that can should get the vaccination. However, this should be a choice. Let's take a care worker. We were told from day one by our care agency, if we don't have the vaccine, we will not get any work. That's very interesting to me. I'd like to hear any more evidence of that. If care agencies are saying no jab, no work. And this tweet says, are care home workers not required to have other vaccinations before they work? Why is adding the COVID vaccination to that existing list seen as such an issue? Let me know where you are with this, 0345 6060 973. As promised, let's hear from Liz Jones, who is Policy Director of the National Care Forum, which is the membership organisation, not-for-profit organisations in the care and support sector. Liz, welcome. How are you?
Hi, Eddie. I'm good, thank you. Thanks for having me on.
What do you think?
Well, we were expecting this consultation, so I guess the first point to say is it's good that it's actually being consulted on rather than being imposed. That's definitely a plus. I think I was listening to what Gareth said, and I think that we are all coming from the same point here. Everybody who works in and around the social care sector is aiming to have as many people in that sector, whether that's people who are receiving care and support or whether that's people working in the sector providing care and support. We want to have as many of them vaccinated as possible. So from our point of view, we've been working very closely with our members who are the employers here to understand what are the challenges in persuading certain groups of staff to take the vaccine. And let's remember, you pointed out at the beginning of this item just how much care workers have been through in the last 12 months. Their dedication, their resilience, their professionalism.
And they're not getting rich either.
No, they're not getting rich either. And that is something that actually it would be really good if the government could turn its attention to in terms of a much more integrated plan in how we can support the workforce to get a better pay, how our members can pay them better, and how they can have more professional routes in, career pathways and all that kind of thing. So I think that we feel that the staff that our members employ have been through a lot in the last year, and the vaccine conversation was bound to arise. But let's remember that staff working in care settings are part of the wider community population, and there is a degree of hesitancy which recent research really does show relates to the speed of which the vaccines have been developed and a lack of research about particular aspects of the vaccine. So I'm thinking, for instance, of younger women who are concerned about the fertility issues, for example.
But to get to the nub of it, then, what would you say to the consultation?
Well, it's a tricky position, I think, because employers, probably like your listeners and the people who will be responding, are divided down the middle here, really, as to whether the best way to ensure as full an uptake of the vaccine as possible is compulsion. So asking people to have the vaccine and telling them that they can't continue to work, versus hearts and minds, persuasion and evidence.
One thing can help with the tweet I read out saying our care home workers not required to have other vaccinations before they work. What's so special about this one?
Well, to the best of my knowledge, no. And I think this is where some of the discussions about comparing care workers with health workers is really interesting. I have been asking the department today for some data on the vaccine uptake across healthcare workers, and I'm not just talking about hospital workers here. There are lots and lots of health professionals who have high levels of contact with the older people that we're talking about here, vulnerable older people, whether that's people working in hospitals to whom older people go for outpatient appointments, or whether that's people who come to visit them in the care home to provide physiotherapy, speech and language, that sort of stuff. So there is a sense across the sector that identifying this subgroup of people who are working closely with vulnerable older people, it is not the way to go. And actually, if those anxieties are true for care home staff, those anxieties will also be true for a wider group of health professionals, and it feels a bit unequal.
Right.
And I would pick up the point from your other caller, or tweeter, who talked about the kind of the 4 points in our armoury for protection against COVID. So the vaccine is definitely one. Good PPE, good infection prevention control, and regular testing are the other 3 things. And Public Health England regularly have advised us that we need to have all 4 of those things in place to make environments as safe as possible. So I guess we've got a little bit of anxiety that the focus on just the vaccine, which, whilst we know it protects against serious illness and death, we have yet to see really good evidence about transmission. Focus on the vaccine only perhaps detracts from those wider messages about how we need to keep going forward in a world where we're going to be living with COVID for quite some time.
Is it easier for the government to force care home workers to get a jab than it is to fix problems with the other 3 things?
Well,
I'll leave that hanging, shall I?
I mean, it's an interest. Well, the consultation is inviting views, and from our point of view, we are really keen, like you are actually, to encourage as many people as possible to share their views.
All right, I'm going to leave it.
Your questions, your questions about whether it's going any further with other groups of people are very interesting, and people might want to reflect on that as they respond.
All right, thank you so much. I do want to get as many people on as possible. We're grateful to you, Liz Jones, Policy Director of the National Care Forum. Graham is in Selby. Graham, what do you want to say?
Hi Eddie, nice to speak to you. First time calling into any video show, but I just felt strongly enough to call in.
Tell me.
I work for the ambulance service, and previously to that I was an army medic for 14 years. In both of those professions, I've had to have the vaccinations before I could do that job. In the army, if we had to deploy anywhere, we had to have yellow fever. In the ambulance service, if you want to join the ambulance service, you have to have your Hep B vaccination as well. But it's because we're going to be in a situation where we're more prone to a bloodborne disease. And let's say in the military, when we're going to foreign countries, there's yellow fever. I don't see the difference with if you're going to be with vulnerable
charged with manslaughter. 20-year-old Dante Wright died on Sunday, sparking violent protests in a suburb of Minneapolis. More than 1,000 jobs are at risk as part of plans to close in-store bakeries at Asda. The supermarket says it will try to move staff into alternative roles, with redundancy the last option. Dry and chilly for many tonight, a fairly widespread frost with fog possible in the west and low of -1.
Nick Ferrari at breakfast. LBC. It would appear that the so-called green silk scandal is growing almost by the day. Shadow Chancellor of the Duchy of Lancaster and Labour MP Rachel Reeves. What does it mean to Mrs Jones in Clapham?
The former Prime Minister has used that contact list of his to get special access to companies that he was lobbying for to line his own pockets because he had share options worth tens of millions of pounds. It is frankly Nick sleazy.
Nick Ferrari at breakfast. Weekday mornings from 7. Listen live on Global Player LBC.
Check in with those you care about and create a smile when they need it the most. With Sync Powers. Amazing every time.
Julius Caesar here. I have trust issues, probably because my friends betray me to death. So when I need a tradesperson, I don't trust them, I trust Checkatrade. They check all their tradespeople and check the reviews are real, so I know they'll get the job done right without the treachery. Recommendations you can rely on.
Gary bought a trampoline online with Visa, so he has protection if his card is used fraudulently. Now Gary's feeling pretty confident. Confident enough to try a slam dunk from his trampoline. Oh, Gary. Visa's zero liability helps protect you from fraud. It just can't protect you from yourself. Search Visa How You Pay Matters to find out more. Commercial and anonymous prepaid cards excluded. Responsible card use required. Contact your bank for T&Cs.
So, that's the sound the gospel choir makes after buying a used car from Kazoo. Yeah, they bought it online and it's been safely delivered to their door at a time that suits them. Ooh, big finish there. Can you buy a used car online and get it delivered to your door contact-free? Kazoo, yeah you can. Kazoo, the safer way to buy a used car.
I've looked after my kids since they were born. Now they've got kids, I still want to look after them. I don't want them struggling to make decisions about my money or my health if I can't. So we made a lasting power of attorney. Now, if I can't speak for myself, they'll speak for me. It's a weight off for all of us, isn't it?
Yes, Mum. Lasting power of attorney. Search your voice, your decision. If you're a business welcoming back your customers, it's important you keep yourself, your employees, and your customers safe. Because around 1 in 3 people who have COVID-19 have no symptoms and are spreading it without knowing. Prevent overcrowding, increase ventilation so that COVID-19 particles are blown away, and ask customers to check in using the NHS COVID-19 app or by providing their contact details. Let's take this next step safely. For further guidance, visit gov.uk/working safely.
Do your teeth stop you from smiling and eating? Do you hate the thought of false teeth? Talk to TDC about Smile in a Day dental implants. TDC Smile in a Day dental implants look and work just like real teeth, so you can eat what you want and smile when you want.
I just wish I'd gone to TDC years ago.
Let TDC restore your teeth and your smile. Book your consultation today. Visit smileinaday.co.uk.
Eddie Mayer Show. Call 0345 6060 973. Tweet at LBC. Text 84850. This is LBC.
6:35, the COVID report in a moment, and before 7, as always, COVID 1 year ago. We're talking now, though, about a UK government consultation on whether or not care home workers looking after older residents should be forced to have the vaccine. Well, not forced to have the vaccine, but have their condition of employment changed so that if they don't get the jab, they don't keep their job. 0345 6060 973, or you can text, as all of these listeners have done, why vaccination for care homes, says this listener. Why not nurses and care assistants and elderly wards in all hospitals? Why are they not included? They need this rule too. These patients are very vulnerable. But the questions raised by this consultation are being exhibited here by Rachel, What if a vulnerable person doesn't want to be vaccinated? Can a care home worker refuse to look after them? Or can a care home deny them a placement? Evelina says, what do people not get? This is not like the other vaccines. The other vaccines have been around for years. This has been around for only months. Who knows what the long-term effects will be? I would never take a job that required me to take this vaccine. And Gary says, isn't it worth offering a payment to care home staff of, say, £250 tax-free if they take the jab each year? Carrot rather than stick. Let me know what you think. Text 84850. You can call 0345 6060 973. Well, as always at this moment, the COVID report. Here's LBC's Daniel Bevan.
Eddie, there's big vaccine news on the continent as Denmark has become the first country in the world to completely stop using the AstraZeneca COVID jab. It paused its rollout last month over concerns about rare blood clots, but health officials in the UK and in Europe have already said that the jab is safe to use. Meanwhile, closer to home, care home staff in England could be made to get a coronavirus vaccine to protect elderly residents. The government has started a consultation period and the final decision is expected to be made in the summer. Scientific experts believe that around 80% of workers and 90% of residents will need to have the jab to have a minimum level of protection against the virus. But it's thought that just around half of care homes in England have that level of protection. Vaccines Minister Nadeem Zahawi says that older people deserve to feel like they're safe.
The COVID virus in elderly care homes is not just any virus. This is a killer virus to those who are most vulnerable. And today's announcement is a consultation because many care home providers have ad hoc decided to make a condition of deployment of staff.
In other vaccine news, a study looking at whether different coronavirus vaccine doses can be used in the first and second dose is being expanded. Researchers in the UK will look at mixing the Moderna and Novavax jabs as well as the ones made by Pfizer and AstraZeneca. Professor Matthew Snape is from Oxford University and is leading the trial.
There are some now studies that suggest you might have a mRNA response with mixed schedules for some vaccines, combining RNA and adenoviral vector vaccines. But we don't know what that looks like in humans, obviously that's the most important thing. If we have to show we have a more flexible schedule, then that will allow more people to be immunised more quickly, which is what it all comes down to.
And moving away from vaccines, surge testing is being carried out in 4 London boroughs following the discovery of the South African variant of coronavirus. Residents in Lambeth, Wandsworth, Barnet and Suffolk are being urged to get themselves tested. Elsewhere on Friday, everyone who can't work in Wales from home will have access to a lateral flow test. That's the ones that will test for the virus and give you results in just around 30 minutes. It's different to the projects that are being announced in England and Scotland, where everyone will be able to have 2 tests a month. But Wales's First Minister, Mark Drakeford, told us last week that he prefers a more targeted approach to testing.
Testing must have a purpose. There must be a reason behind it. There's no point in having a test if it makes no difference to what you do or the future that you have. We already test every week. About a third of the Welsh population, just under 1 million people, get tested every week because of our programmes in social care, in schools, in workplaces and so on. We're not convinced that simply offering everybody a test, whether there's a reason for it or not, is the best use of those scarce resources.
Now, all other major parties in Wales have been giving their thoughts because of the election, and the Welsh Liberal Democrats, Plaid Cymru and the Welsh Conservatives have all welcomed this policy. And lastly, the daily figures. Sadly, a further 38 people have died within 28 days of testing positive for COVID-19. A further 2,491 cases of coronavirus have been reported in the UK within the last 24 hours, and just over 382,000 coronavirus vaccines were administered in the UK yesterday, bringing the total to 32.3 million people who have had the first dose and 8.1 million who have had the second.
Daniel Bevan with the COVID report. We will look back at COVID exactly a year ago in a few minutes. Should it be no jab, no job for care home workers looking after older residents? The government's consulting on that very idea. I want to know what you think. Anita Assel MBE is manager of the Wren Hall Nursing Home in Nottingham and a director at the National Care Association. Welcome back to the programme. How would you contribute to this consultation?
Good evening. I think it's first important to say that we recognise how vulnerable our clientele are, and we want to keep them as safe as possible. So the vaccine is one tool to make sure that our staff teams are, not likely to spread the virus in the same way as they would if they hadn't been vaccinated. However, mandating them to have it it's potentially an infringement of their human rights. It's likely to get the sector to lose a significant number of people working in it. And I just believe that there's other ways that we can encourage people to take up the vaccine. So it's not, mandating it is not something that personally I will support. There needs to be better persuasion, better leadership, and then people will take it up.
One of our listeners just asked an interesting question and asked, what about residents who refuse to be vaccinated?
That's true.